Okay, so we are going to start Chapter 8, Cardiovascular, this is diseases. So diseases and conditions, the first one we're talking about is arteriosclerosis, progressive degenerative disease of the arteries. It's commonly caused by buildup of fatty plaque, or what is called atheroma. Oma means like a tumor, so it'd be like a fatty tumor kind of thing built up in the lung. So you can see in this artery, there's a piece of plaque that is broken away, and this is the artery is just clogged. So what causes the problem is there's plaque in the arteries. That little piece breaks off and gets stuck in a smaller artery, like in your heart or your brain, and then cause a stroke if it happens in the brain, or heart attack if it happens in the heart. So that's why they want you not to have plaque in your arteries. Arteriosclerosis, continued, possibly affecting any artery, but most commonly the coronary and carotid arteries, so that would be in your heart, causes wall weakness, loss of elasticity, and blood clot formation. The treatment is pharmacological. Sometimes they will put you on what's called a statin drug that decreases your cholesterol level, something that thins your blood so it goes through the arteries better. So, and then sometimes it's treated surgically. Endarterectomy is a vascular bypass surgery, and that's where they will put a stent in. And we'll talk about that more when we get to procedures. Okay, so that was arteriosclerosis. Now we're into coronary artery disease. So when you look at the heart, all these arteries and veins that lay on the outside of the heart are considered your coronary arteries. Any disorder of the coronary arteries that affects their ability to deliver blood to the myocardium, which would be heart muscle. Partial occlusion, distal tissues become ischemic, compromising heart function. So we know that that's why they do stress tests. If they do a stress test and you don't tolerate it well, that's an early sign that maybe your arteries are starting to get clogged. And so then if you don't pass the stress test, then they're probably going to go in and do a cardiac cath. And the cardiac cath will tell them, if you have any blockages. And then oftentimes if they go in there and they'll say the left coronary artery and the right inferior artery or whatever are 80% blocked. So if they're able to, they'll put a stent in that opens that up. If they're not able to, then they have to do open heart surgery, cut open the chest, and do a bypass graft, and take that part out and put a new artery in place. Then a lot of times they'll take an artery like from the femoral and bring it up here, cut that part out, put the new part in, if it's not fixable with a stent. So that's their open heart surgery part of it, which is called a CABG, C-A-B-G. The total CAD, or coronary artery disease, total or almost total occlusion of the coronary arteries results in death of distal tissues, a condition called infarction or necrosis. So you can see here it's blocked, so everything distal to that, below it, is starting to die. That part of the heart's starting to die because it's not getting oxygen. So that's called the area of infarct is here. And you see right here it's showing that there's just a little tiny little hole that because it's so clogged, I would say this one's probably 80-90% clogged when you look at that artery. Because it's just like barely a hole there. Almost total occlusion of the coronary artery. Most commonly caused by arteriosclerosis, possible blood clotting formation or rupture caused by plaque. Risk factors include smoking, stress, physical inactivity, so a sedentary lifestyle, family history you can't do much about, diabetes you can keep it under control, obesity, and elevated blood cholesterol. So which one of those things do you have control over? Anybody? Yeah, you can quit smoking. Stress, sometimes, I mean, people are going to have stress. Sometimes you can, I mean, it's how you deal with the stress, maybe, that is under your control. Physical activity, you have inactivity, you have control over. Family history, you do not. Diabetes, that's one of the main reasons of heart and kidney failure, is people who have diabetes who don't keep it under control. If you keep it under control, it won't do damage to your heart and kidneys. If you ignore it and don't keep it under control, then you will have organ damage. Obesity, it's hard to control, but it's something that can be controlled. And then elevated blood cholesterol, that can be controlled by diet sometimes. Sometimes that's hereditary too. If your parents had high cholesterol, you may be likely to be more prone to it too. But there are drugs to help control your cholesterol level. So signs and symptoms. Anginal pain, it just means chest pain. When somebody says another word for chest pain, the medical term for that is angina. So it's saying anginal pain. Shortness of breath. Diaphoresis is when you're diaphoretic, you're just kind of covered in sweat. Okay? That's just sweaty. And pallor is just pale. Some people with that just don't have a good color. They look kind of gray because they're just not getting oxygen like they need. Treatment, surgical intervention. So we have percutaneous transluminal corneal angioplasty, which would be placing a stent. And then bypass would be the next step if the stent doesn't work, open heart surgery. Okay, so any questions on coronary artery disease? Did it answer all the questions on your homework? Nope. Okay. So an aneurysm, you've heard that term before, right? So aneurysm happens in arteries. It's a local dilation, and dilation means it just gets bigger, right? When something dilates, it gets bigger. When it constricts, it gets smaller. So the walls of that artery just weakens, and it kind of balloons out is what happens. It may cause a thrombus, which is a blood clot formation. Hemorrhage, if it ruptures, if that wall could get weak enough that it actually ruptures, because it's stretched so far, it's kind of like a balloon. Once it's stretched, it pops, So ischemia, which means somebody who's not getting good oxygen to an organ has ischemia. And then commonly located in the aorta of the abdomen or chest and in the brain. So when you hear of aneurysms, you hear of an aortic aneurysm or brain aneurysm usually. Okay? There are three main types. Fusiform is the spindle-shaped, so that is that first one. It's just kind of it's ballooned down on both sides of the artery. Okay. Saccular, it's just like a little, almost like a hemorrhoid popped out there on the side of it. And then dissecting is the separated layers, so the wall layer has actually broke through, and now we just got blood flowing out. This is what's making it bulge, not just weakness. Signs and symptoms, you could be asymptomatic. That's the scary thing about that. These are the people that you hear that died in their sleep from a brain aneurysm because it just ruptured in their sleep. Or you hear, it's very rare if your aortic is right in this area, and if that area ruptures, you have to get somewhere fast. You have to have a surgeon ready to go in who knows how to do that to fix it fast. So both of those things are hard to survive if you have a ruptured aneurysm, but it is possible if it's caught in time and you got everything in place where they can get in there and do the surgery to correct it. In a slender patient, you might see a pulsating middle or upper abdominal mass. So when the doctor's doing an assessment, it's like, okay, what is this bulge here? Oh, this bulge has a heartbeat. Okay, that's not good. So they would send them to have that checked, and that's what you hope happens. They catch it before it ruptures. Mild to severe weakness, sweating, tachycardia, and what's that? Tachycardia is what? Okay. Fast heartbeat, yeah. And hypotension, what's that? Hypertension is high blood pressure. So hypotension is low blood pressure. So with this, you're going to have fast heart rate and a low blood pressure. Okay? The treatment depends on the location, size, the likelihood that it will rupture, and the general physical status of the patient. An aortic aneurysm, they would go in and take the bad area out and put a graft in there and a stent to close it back up. Open surgical treatment is a place of a synthetic or stent graft. Brain aneurysm is reserved only for cases that pose a high risk for rupture. So they may know you have an aneurysm in your brain, but if they may just watch it for a while. Just going into your brain and doing surgery could be worse than, actually fixing the aneurysm if it doesn't look like it's high risk for rupturing. Okay, so that's aneurysm. So that has to do with arteries only. Varicose veins have to do with veins only. So varicose veins are the twisted enlarged veins caused by blood pooling in the veins, especially in the legs. Pressure on valves. So we talked about, veins are the only blood vessels that have valves. So you see here, the valves have just got weak, and it's allowing blood to kind of back up. So then you have these bulgy veins on your legs, right? Pressure on the valves from blood overcoming gravity and the way back to the heart. The valves weaken and become incompetent. Common locations are your lower legs. Esophageal varices. So varices is the plural for varicose veins. And esophageal varices is something that is common. It's not the only reason you would get some, but sometimes somebody who's a chronic alcoholic will get esophageal varices. And then hemorrhoids is the other place. And in all those cases, it's the veins in those areas that are allowing blood to back up and cause swelling. So there's a picture of varicose veins in the leg. Of course, varicose veins are different, than spider veins. Spider veins are just little broken blood vessels. Varicose veins are, look more like this, and it's from the blood pooling. So they would be engorged, twisted veins of the legs. They do cause pain and swelling. Edema is swelling. Skin ulcers, it could have a burning sensation, and sometimes they itch just from the pressure on the skin. The treatment would be lifestyle changes, avoid long periods of standing, elevating legs as much as possible, and wearing compression stockings. So there's something called TED hose. If anybody goes in nursing when you're on your feet 12 hours a day, a lot of those nurses, and I do it too when I go clinical, I'll wear compression hose just for circulation reasons and my feet hurting. But that's just a good idea if you're on your feet a lot to wear at least knee-high compression hose stockings. So that would be lifestyle changes. Sometimes it requires surgery. Sclerotherapy is just, when we talk about that more, when we talk about procedures, but it's injecting something that just kind of kills the vein. Ablation, radiofrequency ablation, which would be litigation and stripping. So that's more of a surgery where they actually go in and strip that out. Okay, I think that is it on this. Did you find all the answers for your homework? Yes, done? Okay. All right, so hopefully I talked about everything that was in your homework. Okay, and that is it.